Bismillah ar-Rahman ar-Rahim, Alhamdulillah, wassalatu wassalamu ala Rasulillah. In the name of Allah, the Compassionate, the Most Merciful, all praise is due to Allah, and may His peace and blessings be upon our beloved Prophet Muhammad sallallahu alaihi wasallam. Wherever you are, whatever time it may be, Assalamu alaikum wa rahmatullahi wa barakatuhu. May the peace and the blessings of Allah be upon all of you. And thank you again for joining us on this very Thursday, the 7th of January, on Let's Talk About It. So what happened yesterday, and this is just going to be a quick, comments about what took place yesterday in Washington. It was, by all measures, it was an absolute disgrace. And when I say disgrace, disgrace is actually an understatement of what took place. And for somebody like myself and many of our viewers out there who may be immigrants and maybe refugees who fled wherever back home is in the hopes of coming and living in a more civilized society, politically more stable, maybe we were impressed by the smooth transition of power and the fact that people would go out and vote, and then their votes are counted and their decision is respected. It was always very, very impressive to see these things. And it was always so, mesmerizing as an outsider. But what took place yesterday really, really shook many people. I mean, when I say that it shook us, meaning that all the events were leading towards it, and people knew that, look, this does not look good. It's been in the making for a long time. It's been in the making since he was elected into office. But I know that many of us were shaken and lost trust in that, maybe what happened is that we were too optimistic and too hopeful by how perfect the system is. Eventually, the system does really work, because I believe that this is really a good system. But that's what happens when people relax. That's what happens when people do not pay attention and do not protect their democracy. From the very beginning, and probably, as a clinician, you should not be saying this, but when you observe people for some time and you notice certain traits and characteristics about them, you get to pick up that some people are really, really narcissistic. People who are only concerned about me, myself, and I. They have no regard, no concern for anybody else. Any relationship that they get in is a very transactional relationship, meaning that they're only in it and they ask, how is this relationship going to serve me? Their ability to show empathy, to feel for other people is absolutely very, very diminished. And we saw every single trait of this happening for the past 4 years. Please do take care of yourself. I tell people right now, self-care is really, really important. I know that for us in the Muslim community, some people are very angry and they do not know where to take that anger. I know that be it in the African American community, the refugee community, the immigrant community, the Muslim community, you become a target, and you're constantly afraid of what can potentially happen to you. So getting emails, texts from different parts of the states talking about, we're beefing up our security. We've had nothing to do with what was happening in DC, yet people are saying that, based on what took place in DC, we're just going to beef up the security in our masajid, regardless of how far or close we are from Washington. So please, number one is safety is really important. Please do take care of yourself. And please remember that ultimately our reliance for our well-being should not be on a system, but it ought to be on Allah subhanahu wa ta'ala. So we need to practice self-care where we rejuvenate ourselves emotionally, rejuvenate ourselves absolutely spiritually, and we rejuvenate ourselves psychologically. Having said that, was really excited about our program for tonight, really excited about the guests that we have, and also excited about the topic, given what is going on, COVID, and we thought that it's going to be good times, better times with the vaccine, and I thought that this is what we will be talking about. But then, unfortunately, what took place in DC yesterday just really, really, like I said, was a disgrace. But nevertheless, I am really excited and honored to have our guest here tonight, Dr. Hassan Almoazen, a good friend whom I met when I came here to Memphis, and it's always a pleasure to meet the beautiful people of Memphis. Dr. Hassan, thank you for coming, and it's good to have you with us.
بسم الله الرحمن الرحيم. جزاك الله خير شيخ ياسر. Hassan, not Hassan.
See, that's just how well I know him, mashallah, tabarakallah. Been calling him Abu Adnan. So Dr. Mazen, really, really great to be with you. The credentials are absolutely impressive. Received his education in both Syria as well as in the States. He has a PhD in the topic that we will be discussing, but it's not his PhD that really, really impressed me. He is currently an associate professor and the director of the PhD and the dual degree pharmacology and PhD programs in pharmaceutical sciences at the College of Pharmacy at the University of Tennessee Health Science Center. His research expertise, and this is what I really like, is focused on the design of drug delivery systems and the physical chemical characterization of therapeutics. Man, I don't even know what that means. He is a member of the American Association of Pharmaceutical Scientists, American Chemical Society, and the American Association of the Colleges of Pharmacy. That's a lot of pharmacy you've been doing, Dr. Hassan, and loves to spend time with his family, volunteer in the Muslim community. I can attest to that. And of course, he is a community member here in Memphis. Dr. Hassan Almoazen, like I said, thank you so much for joining us. So I come from Southern California. In Southern California, I've been getting emails from my friends and on WhatsApp messages that at this point, many of their hospitals are absolutely to capacity. Last I read that there was one person that is dying in Los Angeles County every 10 minutes. This last week in the Muslim community, they had over 30 janazas, funerals, for people who were mainly, their death was caused by COVID. We thought that good news came, and that is we have a vaccine. And I thought everybody was going to be excited about the vaccine, but it turned out that not everybody is so excited about the vaccine. So what we want to do is, just explain to just the average person. I am going to be absolutely your average person. What does it mean when we say that we have found a vaccine? What is the process of the of this whole vaccination thing, and the vaccine for COVID? What is the efficacy? What do we anticipate? And so on. And I'm really, really excited to have this conversation with you.
Now, first, let me start by looking at the human body and how Allah subhanahu wa ta'ala created the human body. We have a defense system that Allah created in every individual. It's called the immune system. And the immune system is supposed to identify any foreign objects that enter the human body and get rid of it and remove it. So with this virus, the human body basically will identify this virus and will try to remove it from the body. But the challenge with this virus, we don't know exactly how strong is the immune system within us for each individual. You may have a person who's healthy, who's exercising, who eats well, and he thinks his immune system is strong. And then COVID will hit him, he goes to the hospital, and he passes away. So that's why, we need to be careful. We need to protect ourselves from this disease until the vaccine comes. Alhamdulillah, the vaccine is here. Now, with this vaccine, people think that it came yesterday. Actually, this vaccine did not come yesterday. The background for this vaccine started maybe 25 years ago. 25 years ago, people start looking at the RNA and the function of RNA and how does it carry the code from the genetic materials in the nucleus of the cell into the manufacturing facility of the proteins in the cell and how it generates protein.
Okay, so you just said so many things, and I'm just absolutely lost at this point. So you're speaking about this RNA. What are you talking
Okay, the
about?
RNA basically, in every cell, there is genetic materials.
Okay.
And the genetic materials is called DNA. That's where the genetic materials are for every person. In order for the cell to synthesize proteins, it needs to get commands and the codes from the DNA. So the RNA is basically the messenger that carries the code from the nucleus of the cell into the manufacturing site within the cell to make proteins. Now, many diseases happen because of defection or problems in the DNA that makes the wrong protein. And this will lead to different diseases. So many years ago, scientists decided if there is a genetic materials that is defective or has a problem, how do we fix it? So they came up with different technologies, but in 2018, FDA approved the first therapy of RNA for a rare disease. That was in 2018. And that was a breakthrough at that time.
And that's what you meant when you said that the vaccine was not discovered, now
Exactly.
okay. But you're not talking
Exactly.
about the COVID vaccine itself.
No, I'm talking about the hard work of scientists in this area in the last 20 years that led to the discovery of the vaccine. Now, when I look at the vaccine, I see two innovations. One innovation is the RNA molecule itself. The other innovation is the delivery that scientists developed to carry this molecule, RNA, into the cell. If you just inject RNA molecule into the cell, it's not going to enter the cell. And this is one of the blessings of Allah subhanahu wa ta'ala. Everything in biology is so specific. Like when the RNA carry the code to the cell, after, it doesn't come back. So when you introduce a foreign RNA, it's not going to go to the cell. So scientists came up with a delivery system. They call it the nanolipid particles.
I'm sorry, Dr. Muazzin, before you go on. I think what I hear you say is you're making this distinction of the RNA and the DNA, because I think that part of the reason, and I'm sorry, I'm jumping around here just to get our viewers, engaged. I think part of the objection to the vaccine is that they thought that it was going to somehow damage the DNA makeup. Is this why you're making that distinction?
Yes, let me make the distinction. The RNA function is to carry part of the codes of the DNA into the manufacturing site. So once this RNA departs from the nucleus, it does not come back.
Okay.
And this is the normal function in a cell. Okay? So what scientists developed, this synthetic RNA that we call vaccine, when it enters the body, it does not interfere in the normal function. It doesn't go to the nucleus. You see, once the RNA leaves the nucleus, it does not come back. It stays in the cytoplasm. And then once it makes the protein, it's discarded. So when you introduce a foreign RNA, it does not interfere with the original RNA, because RNA is made specifically by the DNA code. So people are afraid it may mess with my genetic. It will not mess with your genetics. If it's gonna mess with your genetic, the FDA will not approve it. Nobody will take it. Okay, it's well designed so it does not interfere with your genetic information. It will not. Okay.
And that is a scientific fact. I'm sorry. And that is a scientific fact. This is not just your opinion or somebody else's opinion.
Yes.
Okay. Got it. Okay.
Yes.
Sorry to interrupt.
So it will not interfere with your genetic information.
Mm.
It will just, the idea of this RNA that the scientists synthesize is to enter the cell using the lipid particle that they've developed. And then once it entered the cell, it will go to the manufacturing site of protein. And then the cell will begin to make a protein that is exactly the same as the spike protein or the S protein on the surface of the virus. And this particular protein will bind to a specific receptor on the surface of cells. And that's how this virus entered the cells. So the RNA that they have developed will go to the cell, will go to the manufacturing site of the cell, will begin to make protein that is similar to the S protein, and then will secrete the S protein into the plasma or the blood. Now, the S protein is not the virus. It's just a small part of the virus. So we will not get sick from this S protein.
And that is what is injected in us when you take the vaccine.
What is injected in us is the RNA.
Correct.
And the RNA will generate the protein in the body. The cells will generate the protein. And the protein basically will go into the blood circulation. And then the immune system will identify this foreign object and create antibodies. The antibodies basically jump on, these are special proteins that will jump on the S protein and remove it from the body. So in the future, when we get, for example, if we get infected with the virus, the same immune system will immediately recognize the virus, will bind to the S protein, and will remove it from the body.
All right. So in this case, the science has been there, and that explains why the vaccine, the discovery of the vaccine for COVID, was so quick.
Correct. Correct. What speed up the discovery for the vaccine, the previous research in the last 25 years, plus when the companies Pfizer and Moderna opened up the clinical studies, thousands of people joined quickly. Within weeks, thousands of people joined. Typically in clinical studies, it takes years for people to join. And that's why it takes several years. But in this case, thousands of people joined, and when people get sick, they get sick within weeks. So you can see the results of the vaccine within weeks. So you can get data quickly. And that's how they were able to go from phase 1, phase 2 to the third phase. And within 3 months after phase 3, they were able to approve, the FDA approved the vaccine for emergency use.
Okay.
It's not full approval, it's just emergency use under the pandemic.
All right. So, Dr. Almoazen, so some of our views are on YouTube, and please, if you have a question for Dr. Hassan, please do use the chat box on YouTube, and I'm following the questions. And one of our viewers just made the very comment that you just made, and that is the FDA did not fully approve. It was only approved for emergency use. And the question that I have for you is, what is the difference, like a full approval versus emergency use only approval?
The emergency use, because you have a situation where you have a pandemic, and you don't want to, so you look for the safety over several months, and typically with vaccines, the side effects are shown within the first 3 months.
Okay.
So once they pass 3 months, they've looked at the side effects with about 40,000 to 50,000 patients or subjects. And then based on that information, they approved. Now, for the final approval, probably the companies will pursue the same subjects maybe till next year, and then come back with more data for the final approval.
Got it.
But everybody felt safe after 3 months to use the vaccine.
And in this case, this is what took place. The vaccine is being administered for over the past 3 months, and the people who took the vaccine were monitored, looked into the side effect, and that's why it was declared safe enough to be used for the public. Okay. All right. All right. So please carry on. So now we have this vaccine. So if it is as straightforward as you just explained, and it is exact science, it's not like opinions. There is no room for relativism. Why do people object? Why are people objecting to this vaccine?
I mean, every time you have something new, there will always people who will object. Every new idea, there was always people who will object. And there are people who like to stir the pot and create chaos. I mean, we learn from our religion. We always need to seek knowledge. We need to ask experts, right? And then we make our decision. So everything they mention about the side effects, I mean, the side effect could be temperature, right? Some pain in the arm after the injection, right? But it's not going to affect any genetic material. It's not going to cause any permanent defect in the body. It's not going to do any of that.
Okay. We are getting some questions. I'll be sharing them as they come in, depending on whether you address them or not. So one of the questions is, if somebody got COVID and they've already recovered from COVID and have the antibodies, why take the vaccine?
Why take? Well, okay, good question. If we look at the situation now, people get infected, correct? Once you get infected, we don't know who will go through the disease and where the symptoms are considered to be mild or medium, and who will have severe disease and who will die. We've seen people in their 80s going through the disease, and then they have good immune system and they survive. And we've seen people in the 40s going through the disease and dying. So, I mean, we cannot predict who will get the disease and survive.
But the question here was about somebody who already did.
I mean, some people can get the disease and they will develop immunity. That's true. But we don't know who will survive, who will not. I mean, the function of the immune system is to develop immunity and fight the disease.
Okay.
But some people, they may have a challenge in their immune system and they're not able to fight the disease.
Okay.
So a vaccine will help them because they will not be infected by the virus. Only the protein that resides on the surface of the virus will be in their bodies, and they will develop strong immunity. So when the real virus comes, the immune system will be ready for it.
I'm sorry. So are you saying that even, I'm not sure I followed that, but are you saying that even if you've gotten COVID, you recovered, your body might have developed the needed antibodies? Are you saying that the person should still take the vaccine or not take the vaccine?
I advise you take it. Even if you get sick, you get immunity for a period of time. So far, we have conflicting reports on the immunity. Some people say 3 months, some people say 8 months.
Okay.
Even the vaccine, we don't know the duration of the immunity after the vaccine. But so far, I mean, people are advising of taking the vaccine. Even if you get sick, you can still take the vaccine.
I'm sorry, what do you mean when you say that even now we do not know the duration of immunity after taking the vaccine?
Because remember when the vaccine was introduced to the market was like in December.
Okay.
And before that, we have 3 months history, right, in the health studies. By January, we're going to have 4 or 5 months of people who have taken the vaccine.
Okay.
So the companies will monitor the immune response for next year, and they will determine if the body still maintains a certain levels of the antibodies in the plasma.
Okay. So because you took the vaccine does not necessarily mean that you're good to go for forever or for as long as you live or
No, we don't know yet. We don't know yet. So these studies are undergoing.
I see. I see. And again, our viewers are very concerned that do we have enough statistical data to support the safety of this vaccine? Like how many people have been tested? How many, to how many people has this virus been administered? How many of them got sick? How many didn't get sick? Is this information available?
Yes, yes. For example, let me talk about the Pfizer
Okay.
data. Pfizer did 15,000 people who took the vaccine
Okay.
and 15,000 people who got placebo.
Okay.
Placebo means no vaccine,
Okay.
but they gave them like the solution, but there is no vaccine, right? So you have 30,000. 15,000 took the vaccine, 15,000 did not take the vaccine,
Okay.
okay? Now, the 15,000 who took the vaccine, 8 people became sick with COVID.
After taking the vaccine.
After taking the vaccine, 8 people became sick after the vaccine, correct.
Okay.
The group that did not take the vaccine, the 15,000 that did not take the vaccine, 162 got sick.
Okay.
Now, the way they look at the efficiency is by looking at the risk. So the risk, they divide 8 over the summation of the number of people who got the disease. So 8 over 8 plus 162 is 170. So 1 minus 8 over 170 times 100 will give you the percentage of the efficiency of the vaccine, and it was 95%.
Okay. So the
So
eight
this is
people. Okay, so the 8 people that took the vaccine and they got COVID, they contracted COVID despite the fact that they received the vaccine. Why did that happen?
good question. I've looked at the paper because Pfizer published their findings in the New England Journal of Medicine. And I went through the article. They have not explained why the 8 people got sick. So this information is still confidential. Now, remember, when they pick subjects that don't have immune deficiency, but they also picked subjects who have HIV. So among the subjects who got the vaccine, there are people with HIV. So there's potential people with HIV got sick. But there's nothing to indicate what's the status of these 8 because this information is still confidential. So we don't know.
I see. And you're suggesting that because of their already existing HIV, their immune system is already compromised, and that is why maybe they
Maybe,
still contracted the virus.
maybe.
I see. Okay. I see. All righty. Again, we're getting lots of questions, by the way, from our viewers here. Question here is: we don't know if it does or does not. I'm sorry, I'm looking at that. but as I'm reading this, I want to make sure that we make full use of you. So when you hear that Pfizer has made a vaccine, Moderna has made a vaccine, why do we have several vaccines? If the formula is one, if we know what is going to prevent this virus from, harming us, why not just one vaccine? Why do we have several ones?
Okay, good question. Remember when the virus hit China in December, scientists in China released the genetic code of the RNA of the virus.
Okay.
And once the genetic code was released, scientists everywhere start looking at the genetic code and try to identify the sequence that can make the S protein. And the people who were able to use the word decipher, or break the code quickly, were the people in a company in Germany called BioNTech and Moderna. And the reason they were able to do this quickly, because they were working on the RNA technology in the last 10 years to treat cancer and other diseases.
Mm.
So these two companies came up with the same technology because they were working in the same space in the last 10 years. Okay. Now, BioNTech is a small company in Germany. They don't have the infrastructure to scale it up. So they team up with Pfizer. Okay. Moderna is a separate company in the US, right? Came up with the same sequence. But then in order to patent and file patents, you have to show distinction in the formulation.
Okay.
And if you allow me, I can show you the differences in the formulation, and I can share with your viewers the difference in the formulation.
Please do. I probably won't understand it, but please go ahead anyways. Dr. Hassan is too busy to get my jokes, but I think our viewers out there, they did get it. All righty. We are looking at.
Can you see the screen?
Yes, we can, and we're looking at the different components of this is the Pfizer vaccine. Okay.
Yes.
This is the makeup of their vaccine.
The Pfizer vaccine and the different components of the Pfizer vaccine. What we see on top is this is mRNA, which is a synthetic RNA that was made in the lab.
Okay.
Okay. And then below, we have lipids 1, and then we have lipids 2, and then we have lipids 3, and then we have cholesterol. So the second, the third, the fourth, and the fifth items, these are the components of the lipids that will make the nanolipid particles. And the selection of these lipids didn't come easy. That's why I'm saying there's another innovation in the vaccine. The composition of these lipids is to mimic the lipid of the cells in the human body. These are synthetic chemicals that will mimic the lipids of the cell, and inside there will be the RNA in these lipid particles. And once the lipid particle hit the surface of the cell, it will enter the cell because of the similarity in the structure of the lipids with the human lipid structure. And that's where the second innovation here is to get the RNA into the cell. Then if we look down under cholesterol, we have potassium chloride, potassium phosphate, sodium chloride. These are salts, inorganic salts. And the function of these salts is to maintain the environment. We call it the acidity, to maintain the acidity of the environment, to increase the stability of the particles and the RNA. And then if we look down, we have sucrose, which is, we know sucrose, it's a natural product. Sucrose will help with stability. of when they freeze it. So all these components are synthetic components, and safe. Now, if I go down to the Moderna vaccine, you would see very similar. The RNA, mRNA, and then if you look at the lipids, they are a little bit different. Moderna used different lipids than Pfizer.
Okay.
And then if you look at the components at the bottom to manage the acidity, they are also different. So the differences are what they use to stabilize the components and some of the lipids. That's the only difference. And we know Pfizer requires minus 70 degrees. Moderna requires minus 8 or minus 10. So there's a big difference in the stability profile between the Pfizer vaccine and the Moderna vaccine. And that's because of their selection of the lipids. The Moderna vaccine is more stable than the Pfizer vaccine, but the efficacy is the same. They showed the same efficacy.
Okay. Okay. Got it. So so what is a person like myself to do? I'm looking at this and say, look, yeah, these differences don't really mean much to me because I'm not sure I understand them. So as I am picking, is it going to be Pfizer for me or is it going to be Moderna? Insurance picks that up for me, the hospital that I go to. How do I go? And you can stop sharing. You can stop sharing if you're done with that part.
It does not matter which one you take. But so far, it's better if you took Pfizer for the first dose, take Pfizer for the second dose. If you take Moderna for the first dose, take Moderna for the second dose. But either one is fine.
Okay. And Dr. Hassan, again, we're getting people who are still, looking into the vaccine. So is it possible that a person can boost their immune system to the point that their immune system would naturally be able to fight COVID on its own in a way to avoid taking the vaccine? Is that possible?
If somebody gets sick, they will develop immunity. If somebody gets sick with COVID, they will develop immunity. And until we know how long is the immunity, the natural immunity that happens after the disease, then they can delay if they want to delay the vaccine. For example, if we learn that it's going to take 3 months, 6 months for the natural immunity to die down after contracting the disease, then the person can take the vaccine after 6 months.
No. So this is, I believe what they mean is to begin with, they did not get sick. They don't, inshallah, plan to get sick. But what they are trying to do is, I'm going to boost my immune system and make it so good. I don't know how, taking all the natural remedies that they spoke about in such a way that I am going to be healthy enough that I will not be impacted negatively by the virus.
I mean, there's a big risk here.
Okay.
We do not know if we have a good immune system just depending on healthy diets. Healthy diets helps. But we don't know. So my advice, we don't take a risk. We don't know.
Okay. So not taking the vaccine, you are taking the risk because you don't know how your body is going to react to the virus once it enters there. And I think what you said earlier is that we have seen people who are in their 80s, they were able to fight back, and then people who are in their 40s who ended up, passing away because of this.
Correct.
Okay.
Correct.
So Dr. Hassan, what I am getting from a good number of our viewers, and we have a very active chat going on here, is the idea of, look, we are so at the mercy of experts. Like literally, people are just saying, some are making a plea here, say, look, I'm just a layman and I really do not know much. I don't understand what is being said here. But what happens is, I have elderly parents and I am under a lot of pressure. It sounds like the person wants to protect their elderly parents and they're not sure, do I take it? Do I not take it? I'm hearing all these reports. I'm hearing, different views going on. And these people, I think also what we're hearing is people who present themselves as experts, as you are, and they're saying something that is opposite to what you're being saying. What do you tell these people?
Number one, don't listen to just YouTube videos. Don't listen to YouTube videos and what people share on WhatsApp
Of course, we're talking
or
about, don't
on
listen to
Facebook.
YouTube videos except this one,
If
by
you
the
get
way.
confused, yes, yes. I mean, go to the masjid. I mean, go to the mosque, go to the masjid, and ask the imam, ask the physicians in the community, and that's how you become enlightened about this vaccine. I took the vaccine on Tuesday, and I feel perfectly fine. And so my advice to the sister is take the vaccine. Also encourage your parents to take the vaccine. So the
Okay.
safety profile of this vaccine is very good, and there's nothing to worry about.
Okay. All right. So when you say that you took the vaccine and you are feeling fine, were you expecting feelings other than fine after
I mean,
taking the vaccine?
in the documents they shared with me, they mentioned some of the side effects that you can experience. For example, mild temperature,
Okay.
mild fever, like 99, some pain in the arm where the injection site is,
Okay.
fatigue. So these are mild symptoms that will go away within days.
Okay. All righty. So the talk has also been about the mutation of the virus, the different strains of the virus. Will one vaccine work for all? If I took one, I think the case is in the UK. I believe in the United States now. Last I read, we have about 100 of these cases. If I'm not mistaken, in Canada, they're talking about also finding some of that. And what does that mean?
Well, when vaccine mutate, meaning some of the genetic information can change. When it changes, there will be changes in the proteins on the surface of the virus. Now, scientists are still studying these mutations. For example, when they say it's more contagious, we still don't know exactly what is the mechanism to make it more contagious. But so far, what they found, the S protein on the new mutation is still the same. So the same vaccine so far is active against the new mutation. But here is the good thing about this particular vaccine from Pfizer and Moderna. In the future, if we get a mutation that changes the S protein, the companies can go back and modify the RNA with the new code so it can affect the new virus. And that's the beauty of this particular vaccine. It's adaptable, where scientists can modify the code of the RNA to match the new change in the new mutation. So it becomes effective against any new mutation in the future. So we may have different versions of the vaccine as this virus mutate and changes.
Interesting. Very interesting. Alrighty. And then what happens? Allahumma salli ala Rasul. I'm just looking at some of these questions right here. It says that will the COVID vaccine be just like the flu, where there is different vaccine for every year? I mean, you kind of alluded to that.
We remember the disease started in December in China. The vaccine was introduced to the market in December 2020. So the companies will continue to monitor the subjects they recruited in the clinical studies. So by the end of 2021, if we still have immunity, we have a year. Then if it continues another year, then we can say it's continuous for 2 years. We still don't know. So right now, I mean, people initially said 3 months. Then I'm hearing reports that it could be 8 months. So I mean, it's as a function of time, we're gonna learn more about how long this immunity will last. So it could be long term, and it could be like influenza. You have to take it once a year. So we will know hopefully by summer in June if it's gonna last a year or more.
And Dr. Muazzin, you earlier said that the side effects of the vaccine would the symptoms would present themselves within a period of maximum 3 months. Did I hear you say that?
Yes, yes, yes,
Okay.
yes.
Are there what we call the long-term effects of these vaccines?
Well, because remember, the particle, the lipid particles will disperse into the body, and then once they get into the body, then they're gonna make the protein, and the protein will excrete it into the blood circulation.
Okay.
And they noticed from the first phase, when they did the first phase of these studies, that the immunity started after about a week. So from the injection time, immunity start going up in the humans after about a week. And then with Pfizer studies, they've looked at giving the second dose after 3 weeks, after 21 days. With the Moderna vaccine, they gave the second dose after 28 days. So during that time, if there are side effects, we're going to see it immediately. As the system is building immune response, we're going to see if we're going to see any side effects. It's going to be shown within the first 2 months as we're
And,
building the immune response.
and Dr. Hassan, so why is the vaccine broken into two dosages? Why are people not just given one dosage?
Because what they learned, the first dose will begin to stimulate the what's called the immune cells to make the antibodies that will bind to the protein. So the dose that they have used, particularly for example in Pfizer, the dose they have used did not create enough antibodies, right? After 3 weeks, and they needed the second dose
Okay. I'm sorry, but
to
why not
boost the
just
immune
increase?
response level.
Okay. Okay, so why not just increase the very first dosage and give both dosages at the same time?
Typically, if we look at vaccines, every vaccines are different. If you know, like hepatitis B, for example, you take 3 doses. So many vaccines are given in multiple doses. Some vaccines are given in 1 dose. So every vaccine is different,
Got it.
and the way it responds. So these are basically uh, based on studies, animal studies, human studies, and then how the body respond to the vaccine and to the foreign objects. So every vaccine is different.
Got it. And when they speak about the side effects of the vaccine and how it impacted different people, one of our viewers is asking here that some people have gone or they've experienced neurological issues. Um, is that listed as a potential side effect?
No, I don't think the vaccine will have side effects as the virus. The virus, it's well known that the virus people may develop side effects, long-term side effects. Some people may have neurological problem after COVID. Some people may have heart problem. Some people may have brain problem. But specifically with this protein, I don't think it's going to cause any issues because it's the function of this protein is just to allow the virus to enter the cell. But then once it entered the cell, the virus, basically, if we look at the mechanism how viruses work, once they occupy a cell, they will enslave the cell. The virus basically will enslave the cell. The cell becomes a slave to the virus, and the virus will begin to use the component of the cell to grow and manifest itself and replicate. So once the virus enters the cell, we'll use the cell to replicate and make more viruses. So it's going to use our protein manufacturing side to make new protein, to make new genetic materials, and to make new viruses. That's how the virus work in the human body. So when you introduce just a small fraction, it's not able to do all these functions. So people need not to worry much.
Got it. What about people who say, fine, I will take the virus. However, what I will do is that I will wait till the very, very, very end until I see so many millions and millions of people who have taken the virus, make sure that there are no side effects, and then maybe I will feel safe enough to take the virus. I mean, not the virus, the
Okay, my
vaccine.
advice, that is fine. That is perfectly fine. Perfectly fine. Continue to wear the mask.
Okay.
Continue to social distancing. Keep away from people and keep yourself in isolation.
Okay. So let me ask you this. Now that you've taken the virus on Tuesday, are you still wearing the mask? Will you continue to wear the mask? And will you still practice social distancing now that you've boosted your immune system, against this virus?
Yes, but I still wear the mask. I still obey with social distancing. And once I get the second dose, I will be more comfortable after the second
And
dose.
and would you say that once you inshallah take the second dose, then would you not wear the mask or practice social distancing?
I will be less hesitant to be afraid of social distancing because once you have the vaccine, you should not worry.
Okay. All right. And is that ultimately the goal, is to be able to take the vaccine, and then once we take the vaccine, then how much of the population needs to be vaccinated for me to feel comfortable? What percentage are we talking about here?
I mean, that's a difficult question.
Okay.
I mean, I took the vaccine on Tuesday, the moment it was available to me. So it varies from a person to person. I mean, it may be available to you tomorrow and you refuse to take it. I mean, that's your personal choice.
All right.
So, I mean, if you want to wait, that's fine. If you don't want to wait, my preference is I don't want to wait. Take advantage. If it's available to you, take it.
Okay. And then we have a few minutes left,
Now,
Doctor. Sorry, I did not mean to interrupt you. I think there is the uh, um, expert in pharmacology, that is you, Dr. Hassan, and I think there is also the Muslim scientist in you. So as far as your Islam is concerned, what role does it play in the advices that you're just giving us earlier? I mean, because I think one of the appeal is that we want to be talking to somebody who is not motivated by there are no personal interest here as far as you working for Moderna or Pfizer, or somehow you're involved with pharmaceutical companies where you make money. You are in academia. In addition to that, you're a Muslim, you're a practicing Muslim, you're a community member. So the Islam part in this, where does that come in for you?
You know, I remember the hadith by the Prophet sallallahu alaihi wasallam, peace be upon him. إن الله لم ينزل داء إلا وأنزل له شفاء. It was narrated by Abu Huraira that the Prophet sallallahu alaihi wasallam, peace be upon him, said, Allah did not descend a disease except descended a cure. So we all believe this epidemic came from Allah subhanahu wa ta'ala. And Allah subhanahu wa ta'ala will give us the cure. And the cure is here. And I feel lucky because, as I mentioned to you, the RNA research started 25 years ago. If COVID came 25 years ago, there was no vaccine. COVID came at the right time where the shifa is ready for it, where the dawa is ready for it, where the innovation is ready for it, where the scientists and the science is ready for it. So, and that's the blessing of Allah subhanahu wa ta'ala. When we have a challenge, we have to believe that Allah is there to provide us with the solution. It's coming. We just need to be patient, persistent, and keep ourselves aware of what's happening around us.
A person can still keep their trust in Allah, put their tawakkul and reliance on Allah, and still be able to take this vaccine, and there is no contradiction here. It's not a dichotomy. You know what, I have to make a choice either to be a good Muslim or take the vaccine. I think you taking the vaccine is also indicative of you being still a good Muslim. Dr. Hassan, this has been a pleasure. And I feel that, time went by so unbelievably quickly. We still have lots and lots of questions that need to be answered. So I want you to promise us that, inshallah, you will come back again, because we will have more questions. And I think the more the vaccine spreads, we will see how things play out. I think the more questions we will have. And we would love to have you again with us, inshallah.
Inshallah, it will be a pleasure to talk in the future about the vaccine, inshallah. Jazakallah khair.
Beautiful. And to all of our viewers, especially those who have been very, very active on the chat, it's been a pleasure reading your comments and your questions. And thank you all for joining us this evening. And inshallah, we will see you again next week, same time, same place. As I always like to say, with plenty of parking lots, inshallah, so nobody is going to be denied entry. Until we see you next time, we say so long and assalamu alaikum wa rahmatullahi wa barakatuh.